in this picture, what I see a boy who has drooping of the eyelid. It is a Myasthenia gravis history. Myasthenia gravis, it is a disease of the neuromuscular junctions, and the features are drooping of the eyelid, weakness of the arms and legs, change of the voice, and swallowing difficulty. So these are the features of Myasthenia gravis. It comes on clinical and comes on history. So in clinical, the only clue is that the history of worsening at evening. Okay. So this is the clinical finding, and if we go the general observations of the clinical finding is there is a droopy eyelid we find. Vitals are very important, may affect swallowing and speech, and other autoimmune associations like thyroid, pallor, for pernicious anemia and vitiligo. So this is that is droopy eyelid. Myasthenia gravis also come on history, like difficulty in swallowing, difficulty in walking, or 7 years old with history of fatigability, reduce the exercise tolerance and recurrent chest infections. That is the Myasthenia gravis. It comes from Sudan. I'm here discussing how Myasthenia gravis we discuss. So in clinical we take after history, then we do examination of the child, investigations and management. Examine history, already history taking full, then examination we are doing the neurology examination, eye examinations. What are the examination we do? A neurological examination, eye examination, chest examination, MSK examination. These are and chest X-ray for thymus. An investigation for myasthenia gravis are diagnostic is EMG, that is electromyography, anti-acetylcholine receptor antibody, and anti-muscle kinase antibody. And lab we are doing the ANA, anti-DNA, screening for other autoimmune disease like thyroid profile. These are and celiac screening we can do that. Okay. And imaging we are doing chest X-ray for thymus shadow. Plus, we are doing MRI of the chest, ultrasound of the neck if needed. We think thyroid. Endorphin test. Endorphin test is more than 2 years of age. Positive if improvement for few seconds and disappear in minutes. Done with precautions to be done at hospital. IV line ECG monitoring atropine we give 0.1 milligram per kg. Less than 2 years we are doing neostigmine test with peak at 20 minutes. So what are the investigation? Just name I am telling. Diagnostics is EMG, electromyography, anti-acetylcholine receptor antibody, and anti-muscle kinase antibody. Lab is ANA, anti-DNS, and screening for other autoimmune disease like thyroid profile. These are imaging. We can do the chest X-ray for the thymus shadow. Plus, we can do the MRI chest, ultrasound neck if needed. Endorphin test more than 2 years, and less than 2 years we are doing the neostigmine test. There are some types of crisis in myasthenia gravis, that is myasthenic crisis and cholinergic crisis. Myasthenic crisis is that acute respiratory failure, treatment with admission, IV immunoglobulin and plasmapheresis. And cholinergic crisis is overdose of medications, loose motions, lacrimation, salivation, side effects of pyridostigmine, myiasis, bronchospasm and emesis. Treatment is with atropine. So myasthenia gravis, there is acute respiratory failure occur, and treatment we are giving IV immunoglobulin, plasmapheresis, and cholinergic crisis because of the overdose of medications. So among treatment we are giving atropine. What is the treatment of myasthenia gravis? First, antimuscarinic we are giving neostigmine and pyridostigmine. So neostigmine and pyridostigmine, antimuscarinic drug we are giving. Immunosuppressant we are giving steroid and azathioprine. Thymectomy we are doing. Thymectomy, there is an indications for thymectomy if antibody is positive, acute presentation, generalized affections with pressure symptoms. Symptom less than 2 year of period. Benefits of thymectomy is that reduce the dose of steroid and need for immunosuppression, decrease the need to go to the hospital for crisis. New biological treatment, that is a rituximab, GCSF and belimumab. And care of the coma patient. If patient goes on coma, then we admission to the ICU, diet modifications, feeding support, pain management, ventilatory support if needed. Prevention of contracture by physiotherapy, bed sores, frequent changing of positions, deep vein thrombosis, gradient pressure, stroking, secondary infection, prophylactic antibiotics we are giving. This is the whole management of myasthenia gravis and multidisciplinary team. I am involving neurologist, physiotherapist, immunologist, occupational therapist, SALT, speech and language therapist for swallowing difficulties, social worker, dietitian, lies with the school. And I am giving some advice of the child. First, wear bracelet. If the girl in labor, a senior neurologist should attend the labor as the baby may have congenital myasthenia gravis and need respiratory support. So, wear bracelet and also advise the girl. Avoid triggers, stress, exhaustion, tiredness. What are the stress? Mainly avoid any stress, psychological medications. These are avoid some medicine. What medicine causes Myasthenia gravis crisis like beta blockers, azathioprine, ciprofloxacin, nalidixic acid, neuropsychiatric drugs, penicillium and gentamicin. Then educate the parent about the side effects of the medicines. And emergency card plan we are giving, and give extra vaccine, pneumococcal and flu vaccines. So this is myasthenia gravis, and I'm also telling the type of myasthenia gravis. That is neonatal or transient, that are then congenital and juvenile. Neonatal or transient is that baby born to mother who have myasthenia gravis due to transfer to acetylcholine antibody from mother to child, presented early with floppiness, feeding difficulties, weak cry and difficulties in breathing. Antenatally there is polyhydramnios with decreased fetal movements, may develop deformities like anthrogyphosis. Improves with within 4 to 8 weeks with anticholinergic drugs. Congenital is babies born to mothers who do not have the disease. Defect in the neuromuscular junction in the receptors is less severe but less responsive to treatment. Juvenile is present after 10 years more in females, same as adult type with fluctuating fatigability. So these are, and differential diagnosis of myasthenia gravis are myopathy like DMD, Becker muscular dystrophy, juvenile dermatomyositis and hyperthyroidism. Others are GBS, neuromuscular disorders, Horner syndrome. Drugs are botulinum, organophosphorus poisoning. Ptosis, both bilateral and unilateral. Bilateral ptosis occur Noonan, Smith-Lemley, Opitz, Robinson, Tivy. Bilateral third cranial palsy. Migraine, craniocystinosis. Unilateral ptosis occur idiopathic trauma, infection, tumor is retinoblastoma. Congenital ptosis, unilateral third cranial nerve palsy, Horner, Marcus Gunn syndrome, local pressure on the eye. This is all about myasthenia gravis. Thank you.